typically, the people that set the acuity category are going to be clinicians, so they're going to have a really clear idea of where this person falls into. My general recommendation, again, I'm not clinical, so feel free to ignore my recommendation in this. But if you're between two acuities, just throw them in the higher one. And that's because of what we use this for. Why are we categorizing these acuity levels? It's not just for fun, right? Like, it's not to, let's say, even prioritize resources, because when you take a patient on, you are essentially committing to providing the full care that's needed. Like, you can't admit a patient and then let's say they need occupational therapy and you're like, I don't have an occupational therapist, so you're just going to have to go without that and we're just going to do nursing. So acuity levels are really to help you know who to address first in times of crisis. This is very much part of emergency planning. There are, of course, other times that we use this, but all of the times that we use acuity levels are around prioritization of whatever it is we're prioritizing. Because we've been doing a lot of talks around emergency planning, just in general, in our pods, in our articles, I'm going to use emergency planning as the prime example. And I really think that is the prime example of when we use this anyways. And so in the kind of idea of emergency planning, you are prioritizing who you're going to talk to or who you're going to visit, which patients, based on their acuity levels. Because depending on how many patients your company has, you may not have the time to go through 400 patients to see the exact care needs, like the exact details in like a major crisis, right? Like in a major emergency. And we are filming this on July 11th. So last weekend was that big flood in Texas, it's just really heartbreaking stuff. And so anytime there's something like that, it just really makes us want to talk about emergency planning, because not to say that that's any of the tragedy there is related to this, but it's always a good time to remember about and practice your emergency planning and whatever you can do around it. And so that's why we're talking about acuity levels now. So when we are in a big emergency, what we're doing is we have to check on all of our patients, all of them, regardless of what acuity level they're in. But depending on what acuity level they are part of, you are going to check on them differently and at different times. So the high acuity patients, of course, are prioritized, and they need to be seen within 24 hours of a major emergency that would require your company to declare an emergency. Then you have the medium acuity patients, and you want to see them within 48 hours or less. So it's 20 for the high, it's 24 hours or less, 48 hours or less. And for the low, it's 72 hours or less.